Good afternoon, viewers. My name is Samson Z, and I'll be your host. Now, did you know that cardiovascular disease is a leading cause of death for women worldwide? Now, in Singapore, 1 in 3 female deaths are caused by CVD. Now, one of the risk factors of CVD is stress. When a woman often juggle multiple roles, such as careers and family life, and over the past year, due to COVID-19, many may face additional stress arising from changes in lifestyle, work demands, finances, etc. Now, stress can put women at high risk of stroke, diabetes, heart diseases, and other chronic conditions. Now, stress can put women are also often too busy to realize the impact of stress that has on them until the disease strikes. Now, today's Life Health Talk program is about emotional stress and heart diseases in women and how to manage stress and take care of your heart. And in the studio today, we have our speakers and panelists. So joining us, we have Dr. Goh Ping Ping, our cardiologist and chairperson, Go Red for Women Singapore, Committee, Singapore Heart Foundation. And we have Ms. Janice Chen, Senior Occupational Therapist, Department of Rehabilitation, National University Heart Centre, Singapore. Now, before we begin, ladies and gentlemen, during our Q&A segment, we encourage you to type in your questions in the chat function. And of course, we'll be giving away 1 Rosemass automatic blood pressure monitor and 25 goodie bags. Now, complete watching this talk and stand a chance to win. Now, winners will be notified after the event via email. And now, let's begin our sharing and discussion. Now, once again, ladies and gentlemen, heart disease and stroke combined is the leading cause of death and disability in women. Thus, it is important to take preventive measures early to eliminate the risk factors. Let's find out more about this and hear from Dr. Goh with the topic, Women and Heart Diseases, Are You at Risk? Dr. Goh, please.
Thank you very much. So today, ladies and gentlemen, welcome to our talk this afternoon. My topic will be Women and Heart Disease, Are You at Risk? And we will be going through the following points: how to identify risk factors, emotional risk increases the risk of heart disease, and how to manage our risks. Okay, so first I would like to show the mortality statistics from the Ministry of Health. And from these mortality statistics in Singapore, we know that heart disease, including ischemic heart disease, cerebrovascular disease, and hypertension-related diseases account for almost 1/3 of all deaths in Singapore. And this is specifically looking at 2018, where there were 21,000 deaths in that year, of which almost 1/3 or 27% is attributable to heart and related diseases. And we can also see from this slide that the number of heart attacks or acute myocardial infarction is about 11,000 odd cases. And of these, about 1/3 of them are women. And we can also see that when women have their heart attack, they are on average about 10 years older than their male counterparts. So this is a study called the InterHeart study, which tries to identify the risk factors that lead to heart attack in people. And from this study, we know that, in fact, almost 90% or more of first heart attacks has got some reason or risk factor behind it. So it doesn't occur for no reason. And these are some of the risk factors that are listed in the study, such as smoking, lack of exercise, a poor diet, hypertension, diabetes, obesity. And you will also note that I have actually highlighted in red psychosocial stress or emotional risk as one of the risk factors. Heart attack, as we know, is due to this process that's called atherosclerosis, where heart arteries become thicker and hardened, and this can lead to blockages and all sorts of heart problems. And we know that atherosclerosis is what we call multifactorial. So several risk factors do contribute to people getting this problem. The traditional risk factors, like what the earlier study showed us, include the following: hypertension or high blood pressure, hyperlipidemia or high cholesterol, diabetes, smoking, obesity, inactivity, and family history. And this is pretty much applicable to both gender. But we also know that there are some we call non-traditional risk factors which specifically increase the risk in women. And this slide shows some of these factors, and we can see somewhere in the middle there is actually psychosocial stress and trauma. I would also want to highlight from these slides that some women-specific problems like pregnancy-related complications such as hypertension or diabetes during pregnancy do contribute to the women's risk of developing heart attacks later on in life. So what does stress do to the body that contributes to an increase in heart problems? We know that stress can increase our rate of breathing. Stress can increase also the heart rate or irregular heartbeats. It makes a person perspire more easily. The body goes into a state of what we call a fight or flight state, where everything is very tense up. Blood pressure can go up. Blood glucose can go up, triglycerides, muscle tension, as well as clotting capacity. And all these factors is not good for our heart or cardiovascular system. And at the same time, when the body is under stress, there is overall a reduction in good cholesterol, even in immunity, even in the flow of blood that can be seen in the skin, and it also disturbs our sleep patterns. And again, these are not good for the heart. So on the whole, important effects of stress on the heart, I would say, is that it increases the level of inflammation, increases the buildup of plaques, increases the stickiness of platelets or small blood cells that can lead to blood clots, and it causes the heart arteries to constrict or become narrow, and it decreases blood flow to the heart. So you can see on the pictures here that on one side is the heart artery where the interior is very smooth, there was no irregularity, no blockage. But over time, stress plus other risk factors can lead to atherosclerosis, and you can see the same artery where there is a tremendous buildup of plaque, and this definitely can lead to narrowing and heart disease. And we know that specifically for women, women can have serious heart disease even without pre-existing severe blockage. And way back, even in like 2006, there was this study that came out of the USA where it is known as the Women's Ischemia Women's Ischemia Syndrome Evaluation, or WISE study, where they studied 1,000 women with chest pain, and they found that not only do they lack with so-called the typical symptom of angina, but they found that even half of them have actually no significant blockages when they do further studies. But when they studied them specifically with what we call an intravascular ultrasound, or IVUS, it showed that more than 80% of these women with so-called normal angiograms or no blockage on X-ray, they actually already have plaque lesions, and majority of them actually have multiple lesions. And not only that, but their arteries themselves are not normal in the sense that there is an abnormal reactivity showing that the arteries are very prone to going into constriction or spasm even without actual physical blockages. So in summary, we know that men tend to have more we call atheroma or physical cholesterol deposits when they have heart problem. But women, they have more diseases of what we call microcirculation, which is much more subtle and generally is attributable to inflammation as well as remodeling of the heart arteries as well as hormonal changes. And more recently, interestingly, there was a study that was published in the Lancet that showed that stress is indeed linked to heart disease and stroke. And the researchers studied an area deep in the brain, which is called the amygdala, and which is known to handle stress. And they found that in almost 300 people who had increased activity in this area of the brain, showing that they are more prone to stress. When they are tracked over about 4 years, they are found to have higher risk of cardiovascular disease, and they also have higher level of inflammation. So when we say that, there are certain markers we can study to see if a person's heart health or cardiovascular health is good, generally we refer to physical factors such as cholesterol level of less than 200, a blood pressure of less than 120 upon 80, a fasting blood sugar of less than 100, a BMI of less than 25, abstinence from smoking, adequate physical exercise, and so forth. But very often we actually do not have a measure of the woman's emotional health, which has been thus far shown to be very important. So it is important for us to learn how to recognize the signs of stress, and these diagrams show us some of the typical expressions: agitation, hopelessness, self-neglect, personality changes, or withdrawal. And stress leads to undesirable behavioral changes. So if we suspect that a person may be suffering from effects of stress, these are some of the things that may happen. They may eat to calm down, speak or eat very fast, drink alcohol or smoke, rush around but do not get much done, work too much with little result. They may in fact work slower even though they want to work faster. They have a problem with sleep. They try to do too many things at once, and they may be unable to exercise properly. So these are all very negative effects when it comes to heart. And this effect has been studied in many studies. So for example, there is the women's health study where Harvard researchers, they studied 17,000 women, and they found that work stress increases the risk of not only heart disease, but even heart surgery among women by 40%. A Dutch study of nurses in Denmark over 15 years showed that work pressure is associated with heart disease among women 51 and younger. And in Beijing, they also showed white-collar workers who have more job strain. They actually have thicker artery walls. And women are more prone to what we call heart ischemia. Under emotional stress, and heart ischemia refers to the lack of blood flow to the heart muscles. And this occurs in response to mental stress. Study of 678 patients have shown that under psychological stress, women are in fact more prone than men to have their blood vessels constrict, and this is one of the causes that can lead to lack of blood flow to the heart muscles. Women are more likely than men to have this entity we call microvascular dysfunction, where the very small arteries are not actually clogged up with cholesterol, but they just do not relax, and they can still impair the blood flow. And I think we all recognize what is a type A personality, and this type A personality typically competitive people, difficult to relax, very aggressive, achievement-oriented, and so forth. They are generally also found to have higher cholesterol level, higher blood pressure. The blood even clots faster, and they are more likely to have coronary artery disease. Another easy sign to recognize lack of sleep, it is also a form of stress. So getting at least 6 to 7 hours of sleep a night is important. Less than that, there may be higher risk of heart problem. And poor sleep is linked to high blood pressure, difficulty in losing weight, and also difficulty to exercise. So we can do something about stress and improve our health. Some of the pointers, for example, slow down what we are doing, take time to work things out, snooze more, try to get more rest, let worry go, laugh it up, get connected, make friends, and share out your troubles and so forth. So I think you get what I'm trying to say. Get organized, practice giving back, stay active, give up the bad habits, and also make time to do something different, work towards a goal, to spend time with family and friends. So lifestyle interventions is very important. Exercise is a great way to relieve stress, and international recommendation for physical activity would be 150 minutes a week of moderate intensity exercise or 75 minutes a week of vigorous exercise. And this may be performed in about 10-minute episodes, and they also recommend muscle strengthening activities on at least 2 days of the week. But we can also do more than that if we are trying to lose weight. Okay, and this is general health, healthy exercise principles that you can also find on the Singapore Heart Foundation website. Moderate intensity exercise includes brisk walking, 1 kilometer in about 10 to 12 minutes. Other activities like climbing stairs, slow jogging, dancing, swimming, cycling, whatever is sustainable. And we will recommend that you do this 5 times a week. 30 minutes per session, hence the 150 minutes a week, and generally to just keep track of the heartbeat to stay below 170 minus your age. And many people follow the 10,000 steps a day, which is a very good practice, but recently there is also studies that came out from the UK which said that actually 15,000 steps is better than 10,000 steps when they studied the postal workers there. And to do this, to achieve this, we recommend something like 30 minutes walk before work, 30 minutes walk during the work, and 10-minute bouts throughout the day. And also not forgetting, we should also do resistance exercise. These are exercises that help to build up the muscle strength using our own body weight or exercise machine or free weights. And many of these can be done at home also. Intensity of the resistance exercise is somewhere between walking and climbing stairs. And it is gentler on the heart rate. It increases the heart rate, but more slowly, increases the diastolic blood pressure, which is important because diastolic blood pressure is the one that controls the blood flow to the smaller arteries, and hence it can increase flow to the heart arteries. But before we jump into the exercise program, we should always know, pay attention to these pointers, how to exercise safely. Firstly, proper attire and footwear. Make sure that your environment is safe, that you are adequately hydrated. If you have chronic medical condition and you are on regular medication, then the medical condition must be under good control. And always watch for new symptoms. If you are not comfortable with it, you should always report the new symptoms to your doctor. And eyesight must also be checked regularly, otherwise people may be prone to injury or fall. So to sum up, 3 take-home messages. Firstly, women are at risk of heart disease. Emotional stress is definitely a risk factor, and we must take charge and control our risks. Thank you very much for your attention.
Well, thank you, Dr. Goh, for the detailed and informative sharing. Very, very good nuggets for one and all. I hope you enjoyed the presentation. Now, ladies and gentlemen, with our busy lifestyle, it is often easy to neglect our health. And in this session, we'll pick up some tips and strategies to make and sustain small, positive changes for a heart-healthy lifestyle. And our next topic is Living a Heart-Healthy Lifestyle by our speaker, Ms. Janice Chen. Ms. Janice, the floor is all yours.
Thank you. So thank you for tuning in. For those who are curious about what I do as an occupational therapist, I'd like to just clarify that I do not just work with people who have work-related stress, but occupations refer to anything that occupies a person's time. And so I help my patients to be able to manage their daily activities, leisure, sleep, as well as their life roles and relationships well. Okay, and before we proceed, I've got a quick quiz or poll for us, just to check if you have been paying attention to what Dr. Goh has shared. Okay, we'll give some time for everyone to tick all the options that apply for the strategies that are important for heart health. Have we got most of the answers? Yep. All right, and if we can have the results, please. All right, so we've got 99% of you selecting that you should manage your stress well. So well done, you've been paying attention. There were a few trick options there, which is to keep your body mass index of above 25, it should be below 25, as well as the final point of 300 minutes of physical activity. The minimum would be what Dr. Goh shared, which was 150 minutes, but you can gain even more benefits with 300 minutes. All right. Okay. So living a heart-healthy lifestyle involves having adequate nutrition and physical activity. And I'll just quickly go through some of the recommendations. Stress and sleep. So for nutrition, we would recommend for you to use unsaturated fats and oils and choose healthier choice foods, healthier cooking methods such as steaming and stir frying rather than deep frying. Take 2 fruit and 2 vegetables. Reduce salt intake, and you can try to change seasoning with herbs and spices instead of salt. Reduce unhealthy snacking, especially processed foods, as well as drinking water instead of sweetened drinks. Physical activity-wise, Dr. Goh has shared quite significantly earlier. Other things could be to do your housework, like sweeping the floor faster, if you want to incorporate it into your lifestyle, or work out while watching the TV or Netflix. So I will focus a bit more on stress management and self-care, as well as sleep, because these are the areas I work mostly with my patients on. So some common stress relaxation techniques for stress involve deep breathing, guided imagery, as well as progressive muscle relaxation. But for some people, the idea of just sitting still for like 10 to 20 minutes, not doing anything, can be quite scary. So we sometimes recommend for people to do hobbies or activities that have a repetitive or rhythmic kind of movement. And this also puts us in a meditative state that is similar to what you get from the relaxation techniques earlier. Some examples might be knitting, crocheting, coloring, painting, or origami. It could also be household related, such as cleaning, cooking, and gardening, or physical activities, so jogging, swimming, yoga. All these involve repetitive activities. Other recommendations would be to get social support and interactions with people, prioritizing and saying no, and some spiritual practices such as meditation, prayer, and gratitude in line with your own religious beliefs, or actually spiritual practices do not just refer to religion. The next point would be mindfulness, which I will share a bit more as well. So mindfulness is a buzzword that many of us might have heard in recent years. Basically, it refers to being aware of the present moment and not ruminating on the past or worrying about the future. So if you are aware of this, you might notice that a lot of times when you're doing very routine and mundane things in your life, you might be thinking about a problem that you're facing. You might be thinking of something that happened and you're regretting it. So these are examples of not being mindful and present. So we would want to encourage people to practice mindfulness by noticing the external or internal experiences. This could involve the physical senses that you have, even your thoughts and emotions, with curiosity and acceptance rather than judging yourself. So for beginners, we usually recommend for you to practice mindfulness of your breath as well as your body, as well as the physical environment with your 5 senses. So now we will just do some practical activities to practice mindfulness together. So the first would be mindfulness of the body and breath. I'd just like to invite everyone to get into a comfortable position, preferably with your back supported. Also, you may close your eyes or keep your eyes with a soft gaze on a spot somewhere in front of you. So now take a moment to notice how your back and legs are supported by the seat, and allow yourself to soften and sink into your seat. Now I invite you to place one hand on your belly and one hand on your chest, like so. Okay. And with each breath you take, notice how it feels when air enters your nose, fills your lungs, and leaves your nostrils. If thoughts come in, acknowledge the thoughts, let them go, drifting away like clouds floating across the sky. Bring your awareness back to your breath, your breathing, and the present moment. Notice which hand rises more when you breathe in, and feel how the hand rises and falls with each breath. Notice the steady rhythm of your breath and the natural pauses in between each breath. Continue to take a few more such mindful breaths, noticing how the breath feels in your nose, your lungs, and your hands. And when you're ready, shift your attention slowly back to how your body feels in the seat, and slowly open your eyes or focus back on the screen. All right. If you are back with us, can I invite you to type "I'm present" in the chat, and just to make sure that no one has fallen asleep or you're back here, because I have more to go through with you. All right, great, thank you. Okay, I hope that was that experience, that very short practice was good for you. So that was mindful breathing, which you can modify to become deep breathing or diaphragmatic breathing by intentionally breathing to your abdomen. So some of you might have noticed that the hand on the chest was rising more, or some might have noticed that the abdomen was rising more. So if you want to try to practice the relaxation response through deep breathing, you want to try to practice intentionally breathing to the belly instead. So this is usually easier when you are lying down, and you can try this when you are trying to fall asleep at night. All right, so just to get everyone a bit active again, may I invite you to stand up if it's suitable for you, and if you can, go to like a window where you can look out. If you are outdoors, even better to practice this. So this is mindfulness of the environment. Okay, so how this goes is that we are going to pay attention to the different aspects of the environment that we are in, one sense at a time. First, I would like you to notice things as they are and try not to label whether they are pleasant or unpleasant. Okay, so the first sense we're going to do would be the sense of sight. Notice one thing in the environment that you might not have noticed before. Take time to notice the colors, shapes, shadows, and movements of what you are looking at. All right. Next, we'll shift our attention to the sense of hearing. Notice the sounds in your environment. What are some sounds that you might not have noticed before? It could be the sound of the air conditioning, the fan, or even some sounds that are outside your house. All right, now shifting the attention to the sense of smell. So just notice if you smell anything. If you don't, it's all right as well. It's just about paying attention to the sense of smell. Finally, let's pay attention to one thing you feel in your body. So this could be your body position against the surfaces that you're touching, whether it's the floor, or the seat you're at. Could be the clothes against the surface of your skin, the wind, or the temperature of the air around you. All right, and you may return to your seats. So that was a very short experience of mindfulness of our environment, and this can be something that you can practice in your life whenever you take walks or go out of the house. You can take moments to just slowly shift your attention between the different senses, choosing to dwell a bit longer in the senses that you might prefer. Sometimes we would also recommend for you to practice mindfulness in the daily activities. For example, it could be done while you are eating to really enjoy the food, to really feel how the different textures are in your mouth, the different tastes and the smell of the food. Or some people actually also do it while they are showering, like the scent of the shampoo, the soap, and the water. Another way we would recommend for people to make use of this mindfulness would be to create an environment with sensory input that you really like. For example, it could be turning on the air conditioning, preparing a hot or warm drink, wrapping yourself in a blanket, and putting on some soft light music. And when you're doing this, you can slowly, alternate the attention to the different senses again to really gain the most relaxing effect. All right. So now we'll move on to the next section, which is about sleep. You can try to incorporate the things I've talked about, stress management and relaxation for sleep. So as Dr. Goh has mentioned earlier, sleep duration is linked to cardiovascular disease. So a recent study last year shows that Singaporeans are now getting more sleep, but almost half, or 49%, said they were not satisfied with their sleep. So I'm going to go through some strategies or recommendations about how we can improve the quality of our sleep. So we would like to recommend for at least 6 to 7 or up to 9 hours of sleep, because there has also been some evidence that sleeping too much is also linked to some other health risks. Aim for regular sleep and wake times, even on the weekends, which can be very hard for a lot of us because we always want to try to catch up on our sleep on the weekends. But ideally, if you keep to a regular time, your body would also learn to have these regular sleep and wake cycles as well. Refrain from taking long daytime naps, especially after 3 p.m. And if you really have to, just keep it really short, like 10 to 15 minute power naps. Keep the bed or the bedroom for sleep and sex only. So this is to help our body and our mind associate the bed or the bedroom with restfulness rather than wakefulness. So I know with COVID, a lot of us are working from home. You might have heard of such recommendations as well, to try to create a separate work environment that's separate from your bedroom. Avoid caffeine from lunchtime or the afternoon. And avoid large meals, smoking, alcohol, or vigorous exercise or overly stimulating activities close to bedtime. And so the recommendation for exercise would be about 3 hours before bedtime. So try not to exercise within that time frame. So have a relaxing nighttime routine without using electronic devices for at least 30 minutes to 1 hour before bedtime, because the devices would produce the blue light that keeps us awake. And if you're unable to fall asleep for more than 20 minutes just tossing and turning in your bed, try to leave the bedroom and do a relaxing activity until you feel sleepy. So this is also linked to the idea of associating the bed with restfulness rather than wakefulness or being alert. Some examples about how we might do this would be to read like a neutral kind of book, not an exciting novel that you want to find out what happens in the next few chapters. So the idea is to just prepare the body and the mind for rest and for sleep. So these are the 4 key areas which you might realize are very interrelated. But we often have a lot of reasons, or what some people might call excuses, and have difficulty practicing some of this in your life. I have a poll now to find out which you think are your top reasons or difficulties that you have in practicing the healthy lifestyle recommendations. You can select up to, up to 2 or so. Yeah, just try to keep it to the top 1 or 2 reasons you have difficulty doing so. Just a few more responses. And if we're ready, we can have the poll results out. All right, okay, so the top reason identified by most people would be no time. Next would be too tired. Yeah, these are the top 2 reasons identified. Yeah, okay, so I'll try to focus a bit more on that. So yeah, some of the common challenges specific to women would be the multiple roles that women play, whether it's caregiving, doing the housework, the cooking, and even working in our modern society. Also the stress responses, of which the most common one is fight and flight, which Dr. Goh has shared about. But for women, another common stress response is actually the tend and befriend stress response. So with this stress response, women often try to be more nurturing or more caring towards the people around, like such as your loved ones. And this often demands a lot from us. And in doing so, we might overextend ourselves and overtire ourselves as well. Next, women experience some emotions more strongly, and emotions are also also affect the women's heart more. All right, so how to take the steps forward? I've come up with the acronym of me and he or her, because routines can be shifted to the bottom. So me, he, or me, her. So it's a reminder for us to take care of ourselves so that we can better take care of those around us. So the first one would be motivation, which is the heart of the matter. So we would like to identify a personalized reason about why we want to be better. What does living life at its best look like to you individually? What kind of person do you want to be like? So this involves exploring your core values and your desires. And here are some examples for you to consider. So it can be feeling more joyful, more peaceful, or energetic and fit and confident. Could be giving your best to your loved ones or being a good example to those around you. Having meaningful relationships or contributing to a bigger cause than yourself. So the next step involves experiments or making specific action plans or goals. We sometimes call it experiments because, with work we have lots of goals and targets to meet already, and we don't want to add on to the stress that you're already facing by having more targets and goals for your life. What we want to do is to have experiments where we identify small, achievable, and sustainable changes which you are confident in trying. So that is just the first step, being confident in trying it. And the idea is that as you try and you get more positive experiences, it builds on to the confidence that you have in making these changes. So just honor and respect your own uniqueness and preferences, as well as the stage of life or season of life that you're in. For example, if you're having a peak period at work and just going to the gym or joining an exercise class seems quite impossible, then it might be a time to choose another experiment that suits you. Perhaps like finding just some short periods of time to do some relaxation strategies. So this is all about being curious and learning about yourself and what works best for you. So I've got a quick poll again here for you to think about what are the specific changes or areas of lifestyle changes you hope to make in the short term, like say the next 2 months. So as I go through the next final few slides, I hope that you can, have the specific behavior change in mind, and so that you can apply it more specifically to your life after this talk. All right, I think we have gotten most of our poll results in, so let's take a look. Wow, okay, so 70% of you have identified stress management and self-care, which is, I guess, why you have signed up for this talk today. The next would be physical activity, as well as sleep quite closely in, and the final would be healthy eating. Okay. All right, so with the experiment for the so with the experiment that you have identified, these are some questions to help you evaluate what helped you and what did not help you so much. So what helped you to be successful? What are the challenges you faced? What did you learn or notice about yourself? And what change would make it more likely for you to succeed? So next would be habits and routines, which is the key to consistency. Habits and routines actually help us to do things more automatically and less effortful. And the idea of tapping onto habits and routines would be to maximize the natural moments in the existing routine. And we need to do this by intentionally and mindfully breaking out of the autopilot mode when forming new habits. So I commonly recommend for people to identify the key moments that always happen in our life, whether it's the morning routine when you wake up, the 3 meals that you take each day, or traveling for those who travel to work, so the commute or journey that you take, as well as a nighttime routine. So if you identify some of these moments in the day that you could intentionally try to insert the relaxation or self-care practices. So we want to build habits by identifying a cue that could be what I mentioned, like the time of the day, or a sequence of habits and actions such as like washing up, or it could be an emotional or physical state, or an environmental cue. So by doing so, we can then build in a behavior or routine. For example, something that I've tried would be to use the time when I walk home from work every day, like from the train station back to my home. I try to make that a time where I intentionally practice the mindful awareness of the environment. And actually, in doing so, it helps to take your mind off the autopilot mode. I realized previously in one of my experiments that I often tend to go to like using my phone or when I'm walking or even in the train. But when I tried to be mindful about it, I was able to notice a lot of things I did not realize that were in my neighborhood. And it was also, it's good to appreciate like what's around you in nature. So actually, if you identify experiment in line with your wellness vision or values, you actually experience a reward, and intrinsic reward is what really helps you to sustain it. But for those who like external, like a visual representation of a reward, sometimes you could use like all the different apps that you have to accumulate like the amount of time you spent on relaxation or mindfulness practices, or even sleep. If some of you might be tracking how much you are sleeping, and if you are able to have that reward build up, it could be an additional form of motivation for you. Next would be setting up the environment for success. So whether it's having a water bottle or using the different apps on your mobile phone, or having healthy snacks nearby. For example, if you wanna, you like crunchy foods, but you keep finding yourself going to like potato chips when you're stressed, you might wanna have like healthy alternatives, easily accessible, like like cucumbers or carrots or fruits. Right, and motivational items as well that can remind you of your wellness vision and what you want to achieve or feel like in your life. Finally, the final part of tapping into the environment would be the social support. So having emotional support or someone who can provide a safe and listening ear, empathetic listening ear for you to share how you are feeling and to process your experiences. You can also find people who are companions or can journey with you on this journey of making small lifestyle changes, going to exercise with friends or doing something relaxing or self-care with people that you value. You might also want to consider practical support, such as getting people to help with caregiving or housework if you really need to offload some time for you to practice stress management and self-care. And also seek out information from people who might know a bit more about things as well. All right, so that's all I have for today. Thank you.
Well, thank you, Ms. Janice, for the therapeutic, calming and relaxing information and exercise segment as well. And for you guys at home as well doing the poll, thank you very much for your participation. Well, ladies and gentlemen, it's time for a Q&A, but be reminded that we hope you'll keep your questions to the topic of emotional stress and heart disease in women only. So we have our first few questions and directed to Dr. Goh. Now, how to mitigate heart problems when women have lowered estrogen after menopause and could even be made worse with the hormonal treatment of estrogen for positive breast cancer women? What would be your answer for that?
Yeah, thank you for the question. So, if you recall, in one of my slides, I showed that when women have their heart attack, they are on average about 10 years older than the men. Mm-hmm. And that is precisely because the post-menopause state, where the estrogen level becomes lower, that is actually a risk factor for women. In a way, this lower estrogen level is a natural progress in life. We can't exactly mitigate it that much. Medically, we do not actually advise people to take estrogen to prevent heart disease because it comes with other problems. So I think it's still through management of other risk factors so as not to add to the risk that is already intrinsic to the process of going into menopause. So that's where the management of the other so-called preventable risk factors actually come in. So like screening and treating high blood pressure, high cholesterol problem, diabetes, management of stress, because that is also, I think it must have been identified also as one of the key periods in a woman's life where a lot of stresses occur, and of course abstinence from smoking. I think that is very important.
Well, Dr. Goh, another related question about heart health. Now, can heart attack patients be, is it hereditary or genetic? Can it be prevented, or is there a way to escape it as well?
Okay, so when we look at the risk factors, actually we broadly can classify them into modifiable or preventable and non-modifiable. So like for example, menopause is not preventable. Family history or genetic tendency also is not preventable. So there will be people who have strong family history of, for example, very high cholesterol or heart disease, where we usually identify them by getting a history of having parents, siblings, or close relatives who have had heart problems at a young age. So if they already have that kind of history, they have a genetic predisposition, and therefore this is also the group where they have to actually work even harder to reduce other risk factors.
There you go. Well, the next question is for Janice. Now, Janice, regards to stress, are there any anti-stress supplements that one can take, be it medically or organic in this case? Much of them are talking about organic right now. What would be your answer?
Honestly, I do not have any specific supplements that I would recommend. I think the supplement, if you can consider regular sleep and relaxation as a supplement, then yeah, I guess that's it.
Of course, proper dieting as well.
Yeah.
As you mentioned, 2 vegetables and fruits a day.
Yeah.
Well, that will be, of course, a more natural way to suppress stress in many ways.
Yeah.
Okay, let's see what else we can. Now, someone says that they usually sleep about 6 to 7 hours a day, and does it affect the person's lung in the long run? Should a person be probably sick with heart diseases? Does it affect the person if they sleep too long? Maybe Dr. Goh might also share as well.
I think like what Dr. Goh has mentioned, sleep is one of the risk factors, and it is also a modifiable risk factor. How much it really affects our heart in the long run, I don't think we can specifically pinpoint that it's because of sleep, because sleep is also associated with like stress, as well as it could also reflect some some poor sleep could reflect some other underlying medical conditions, and if you are concerned, you may wish to investigate this further. Yeah.
Now back to Dr. Goh. Question for you is chronic or congestive heart failure reversible? Now, should such patient exercise more, like brisk walking?
Yes. So, chronic or congestive heart failure actually refers to the medical condition where the heart becomes weaker, so it doesn't pump as effectively. The heart artery blockages problems that we were talking about earlier is one of the main causes of this. So actually, when we are talking about prevention of heart disease, we are seriously hoping that people do not progress to this state. But of course, some people actually do, and we do encounter quite a lot of cases like this. And I would say that they are largely controllable with medication, such that most patients who are under good control with medication are able to function just like anybody else, and they can also still have good stamina. And definitely, when the condition is under control, they should exercise more, because then it also helps them to maintain the good state of their health. Yeah.
Now back to Janice. Now, Janice, I understand that most of the slides presented are for people working in a 9-to-5 environment on a regular basis, but there are some people who work on several different shifts, like 3 different shifts and all that, so they have different timing, irregular hours of sleep and rest as well. How do you recommend a form of a better healthy lifestyle to prevent for these working adults?
Yeah, actually back to the question about the supplements, I do know that some people take melatonin, but I would recommend for individual to consult the pharmacist or the doctor about what is the appropriate dosage that is recommended for them. As for people who do shift work, I think some of the similar principles would apply, such as like if you are going to have the extended duration of sleep, to avoid like vigorous exercise, and have like a pre-sleep routine rather than a nighttime routine. Have a relaxing pre-sleep routine, and to try to get at least maybe 7 or 8 hours. You might need a bit more sleep because of the irregularity as well. So for those who are working in shifts, perhaps you can shift the minimum amount of sleep up a bit as well. And also consider the environment that they are in. So if you're working in shift work, sometimes you have to sleep in the daytime. You can consider getting like curtains that block out the light so that it's more conducive as well. Earplugs, to block out the noise that might be happening during the daytime. I know sometimes like there's like renovation works happening, so that can really affect the quality of your sleep.
So do consider the working environment, guys, the working time as well. If it's unsuitable for you, then you might want to decide going to a 9-to-5, or you have more time on weekends to exercise. Great. Okay, we have more questions for Dr. Goh. Now, what is heart murmur, and will it lead to heart problems? What is heart murmur?
Heart murmur is a general term that refers to a sound that people can hear when they apply a stethoscope to the chest. So it's an extra sound coming from the heart that is not supposed to be there. And it may indicate a broad spectrum of things, ranging from very harmless, like just some people maybe have very thin chest wall, so they conduct the sound very well, and you can just pick up additional sounds, but actually there's nothing wrong with the heart. Ranging from that kind, harmless, to actually problems with the heart valves, which are either not closing properly or not opening properly, and it also may be due to weak heart function, enlarged heart. So if a murmur is detected, very often it's detected, say, during health screening, general checkup, or maybe when someone goes to see a doctor for unrelated causes. If it is a murmur that is picked up, it is consistent, repeatedly can be heard, then it should be further evaluated.
There you go. So do seek some medical attention if you feel uncomfortable, like you're not sure. Well, for Janice, more about stress-related topics. Now, can mindfulness practice or breathing practice be done any time of the day?
Yep, certainly. So in the practice that I went through with the audience earlier, we placed the hands on the chest and the belly. You can choose not to do that as well and just focus on paying attention to your breathing. Yeah. So it can be done any time of the day, whether you're traveling, you're eating, before you sleep. So yeah, as and when you need it, or as and when you realize that you might be really stuck, in some thoughts that you're not getting out of, and just taking a break from that can be helpful as well.
Or you might want to just probably download a very nice sentimental music.
You could.
To just plug your headphones anytime when you want it, yeah?
Yeah, correct. Simple. So it's a very individual and personal preference. Some people might like music, some might actually prefer like rain sounds, so explore, experiment, see what you like.
Exactly. So try the senses. It could also be visual as well.
Yeah.
Putting a photo of yourself in Disneyland, and then you go through the emotions of being there and feeling good, right? A quick break from things. Right, more questions coming up right now for Dr. Goh. Now, this is also a personal question as well, because my mom-in-law is going through this right now. Now, listen up. Is it true that breast cancer patients are more prone to heart problems? What are the signs and symptoms that we probably will see?
Okay, so breast cancer patients, they are not more prone to heart problem from the breast cancer itself. So there is quite a separate medical disease that's got to be treated on its own merit. But sometimes certain types of treatment for cancers as a whole, especially if we are referring to what we call chemotherapy or immunotherapy, and some of these are actually very fast developing fields. And some of the treatments may be linked to heart-related effects. So we may have people who develop irregular heart rhythm, chest pain, even enlarged heart or weak heart from certain cancer treatments. But these treatments are very effective and it's very essential for them. So the best we can do really is to, and I'm sure the doctors who are managing you are aware of these effects, and it can be monitored and tracked. So if certain things start going abnormal, then early evaluation is the key to tackle this. Yeah.
Also, it could be the initial news of having fear and anxiety that causes them to breathe abnormally and feel hurt, and full of stress. That's where the exercise comes in.
Yes.
So having a calm mind to protect yourself from this might actually help. Yeah. Okay, a few more questions to go. Now, once again, ladies and gentlemen, don't forget to stay with us at the end of the program where we have some prize giveaway. But right now, keep your questions coming in. Now, what are the earlier signs of heart diseases in women that might show, and how can we observe it? Perhaps to Dr. Goh?
Okay, so the commonest heart disease symptom really is chest pain or chest discomfort, and particularly so if it comes on with certain activities, physical activities, walking, going up flight of stairs, something that you normally can do quite effortlessly, suddenly gives you breathlessness or give you chest pain, and that is what we call typical heart symptoms or typical angina. But we do have other less common, or we call atypical symptoms. For example, and I think one of the questions touched on that also, is that there might be overlap with, say, symptoms that feels like indigestion or acid reflux and so forth. And they may even be very vague symptoms that people just generally feel tired because their heart is not functioning as well, tiredness, just non-specific breathlessness, and irregular heartbeats. Yeah.
Now I've got one more question related to heart as well. Dr. Go, tell me if this is a myth or a fact. Now, for women who have normal cholesterol, blood pressure and blood glucose but are stress prone, now are they still at high risk of heart disease after menopause?
Yes, so I think it is a fact that people can have heart disease even if they have very normal, so-called other normal parameters like blood pressure or cholesterol or diabetes. Yeah, because intrinsically some people may already have like increased risk from family history, and then not forgetting things like smoking and all this stress that is really a lot of it is not measurable. Yeah.
Right, there you go. So we'll take another 3 more questions, everybody, before we end our program. Now, here's more question. Now, how to know if it's heartburn or heart-related problems and when to see a doctor? What are the differences between heartburn and heart-related problems?
Yes, so heartburn actually is not a heart problem. It refers to the burning sensation that people feel behind the chest, and it is usually due to acid reflux. So it's actually a stomach problem. Yeah, but it can feel like heart problem. So I think if the symptom is very much related to meal, like when you are very hungry or when you are very full, you get this problem. And if you change your dietary habits and it gets better, or if your doctor prescribes you gastric medicine and it gets better, then it's very likely to be gastric problem. But if despite that you get it keeps happening repeatedly, then I think you cannot assume that it is still due to the gastric problem. Then I think you should really get the heart checked out. Yeah.
Okay, more questions as well. Now, does heart palpitation increase the risk factor of heart diseases? Is it related in a way?
It is a symptom of several heart diseases. Yeah, it is not exactly a risk factor, but it is what people may feel if they have certain heart conditions. Yeah, so it's also a symptom that not to be ignored, I would say, if it is recurrent and it's been going on for some time.
Okay, so one final question going out to Janice. Now, Janice, I understand that sports and fitness is very important as well. But are there specific sports for patient with heart disease? What kind of sports that they can do, cannot do, that might be too stimulating? Some of these strenuous exercise.
I think, yeah. I mean, it depends on like whether the patient, the person actually has a heart condition, right? So all these are really tailored to the individual. There are some like tests to check like what is the exercise capacity and how much to exert. When we talk about like overly stimulating, I think you go best by kind of just recognizing like what your own limits are, like just recognizing like the symptoms like the chest discomfort, shortness of breath. Yeah, and those I think are good places to start with. Like, do not ignore those things, as well as like sometimes overly stimulating activities can be like physical, or it could be something like that's overly like emotionally stimulating as well. Sometimes like nowadays with social media, with a lot of comparison and all that, sometimes if we look at social media, we might get into a very negative emotional state when we realize that people seem to be having perfect lives like out there, and our life in comparison seems like so far from what other people are experiencing. So it's kind of having like a recognition of like what are your emotional or even physically what things affect your emotions, or how much how you recognizing your emotions and the physical cues basically I think would be a good way to move forward.
So really basically understanding yourself, and reading your own body performance as well. Okay, so they take note, everybody, to read and understand your body as well, okay? So to our speakers as well, what is the one thing or takeaway that you'd like to share with the viewers today before we end our session? Perhaps Dr. Goh?
Okay, I would say recognize that stress is a very important factor in your life.
And Janice?
I think it would be recognizing your own your own body, your own emotions, your own thoughts, and what works best for you, and to take care of yourself so that you can be a better version of yourself for the people around you.
There you go. So listen to yourself. Well done. Okay, so we thank our speakers for joining us today, and to those of you at home as well and at work, thank you for joining us in a live talk. Now we'll be picking up the winners for the BP machine and goodie bag using a randomized system, and we'll inform the winners via email. Now also take part in our program, which we want you to do is to head over to the Go Red for Women 2021 virtual event page at goredforwomen.myheart.org.sg from Monday 8th of March, which is also the International Women's Day, for a series of heart health activities that will be coming up over the next 2 months. And also, ladies and gentlemen, we would appreciate if you could take a few minutes to share your views and feedback. Now, we value your opinion and we'll use it to make improvements in our future events. With that said, ladies and gentlemen, we end our program for today, and we'd like to wish all of you a blessed and a wonderful week ahead. Thank you very much.